Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel today. Once again, I'm here to remind you that if medication fixes your problem, that makes it a medical problem, not a mental problem. I hope that's encouraging to you. Those of you who are taking medications for your brain chemistry or considering taking medications for your brain chemistry. Today I'm going to talk about a medicine called Auvelity, A-U-V-E-L-I-T-Y. Auvelity is a brand name medicine that you might be seeing advertisements for on the internet and on television. And the reason I'm talking about it basically is that a patient asked me about it, or a commenter asked me about Auvelity, and if that was a good thing or a bad thing, and really what is it. So the fact is, Auvelity is a brand name medication. So that means that in today's world, because whenever, as I said before, if you see ads on television, that means that the medicine is still covered by trademark protection and patent protection, and it's going to be very expensive. So I typically shy away from medicines that cost over $1,000 a month. A lot of people say, hey, well, insurance pays for it. Well, somebody pays for it, even though insurance is paying for it. We all pay for medicines when they're more expensive. Now, does that mean that there's not a time for expensive medicines? Obviously, there is a time. But the question is it a good idea for me to be using Auvelity in my practice? And the answer is basically no. I'm not using it right now, so I don't have a lot of experience. So why am I talking about it? Well, because basically it's a medicine we've used for years, plus another medicine which you've known of since probably the 1950s or 60s. I don't remember when Dextromethorphan was invented, but Auvelity is basically Wellbutrin plus Dextromethorphan. And if you remember hearing about Dextromethorphan, yes, it's cough syrup. And when abused, if you've heard about the phrases like robo-tripping or something like that, Dextromethorphan in high doses can make people feel like they've had too much to drink and have alcohol. And I have actual clinical experience with patients becoming addicted to cough syrup in the same way that another person might become addicted to alcohol. So today's really not really about Dextromethorphan as much as what is the combination of Wellbutrin plus Dextromethorphan, and what does it do for you that might make it different? Well, just to review, Wellbutrin, bupropion is the name, so I probably should be not using the brand name Wellbutrin, but that's how I think about it. Bupropion plus Dextromethorphan equals Auvelity. Now, what does bupropion, the brand name Wellbutrin, do? It's a norepinephrine booster. So if you haven't seen those videos, you can look back and watch videos about Wellbutrin. But basically, if your norepinephrine is here and you need it to be here, then Wellbutrin is a tool that does that. So Wellbutrin is good for any condition that causes that is caused by low norepinephrine, and bupropion is good for anything that clinically becomes a problem, such as depression, sometimes anxiety, and very often attention deficit hyperactivity disorder, ADD, ADHD. So those are the things we think about. Typically, depression or ADHD is caused by low norepinephrine. So bupropion, trade name Wellbutrin, we believe that it helps by raising that. So why would you take a medicine that has Dextromethorphan added to it? Well, Dextromethorphan's been around for a long time. As I said before, it's a major ingredient in lots of cough syrups. You don't even need a prescription for it today, and you can actually buy it if you want to, and that's how people get addicted to it. But what we know about Dextromethorphan has to do with this chemical called glutamate. Now, there are other medicines that relate to glutamate, and it's an interesting concept that glutamate actually is one of the major neurotransmitters in your brain. It's one of the chief chemicals in your brain. And what we believe is that too much glutamate is a bad thing. So if there was a way to score your glutamate in your brain and say, okay, well, if you have too much, you have symptoms of more likely to be depressed and anxious. And some people believe that it may even cause neurotoxicity. That is to say, make your brain cells not work as well, not live as long, not be as functional. So too much glutamate bad. And what we know is that by blocking what's called the NMDA receptor, which you don't have to remember this, but it's N-methyl D-aspartate receptor, that's what it's called. The NMDA receptor, if you block that, we believe that reduces glutamate activity. So taking your glutamate from here to here, that is believed to be a good thing. So the combination of bupropion to boost your norepinephrine and reduce your glutamate sounds like a pretty good idea. The question then becomes, is it worth $1,000 a month when you can get Wellbutrin for, $10 or $15 a month, and you can buy generic over-the-counter dextromethorphan if that's what you wanted to do? And in fact, you could absolutely do that. I'm not suggesting that you personally do, but you could talk about it with your doctor. I don't believe necessarily, even though if you read the internet, and unfortunately I spent a lot of time preparing for this video, reading stuff on the internet, that's sometimes a little bit sketchy. Like one of the things that when you get something that you believe is true and then it takes you to a source, which is actually an article by somebody who may or may not have an agenda, they say some things in there that are very sketchy, like Auvelity achieved 46% remission in their patients where Wellbutrin only achieved 16%. Well, I just don't believe that, because in my practice, when I take care of patients and I give them the proper dose of bupropion, Wellbutrin, guess what? They achieve remission. They go from 10 or 12 symptoms of depression and anxiety down to 0 symptoms. That's when a patient comes in and they feel terrible with depressed mood, low interest, low energy, hopeless, can't concentrate, thoughts being dead. And within a month, they come back and they say, hey man, I'm so much better. I saw a patient today, actually, who the only thing we did for that patient was to go from 150 milligrams to 300 milligrams. And it was like a light switch. He said, I'm just back to myself, doc. I can't believe how much that helped. It's crazy to me that such a little change would make such a big difference. That's what he said to me this morning. And that was simply just raising his bupropion, his Wellbutrin, from 150 to 300. So for somebody to tell me that Wellbutrin only gets people to remission, in other words, makes them only feel 16% of the patients. Well, if that's their statistic in their study, all I can do is say that doesn't jive with my clinical experience, because Wellbutrin does get people well. Now, is dextromethorphan, in addition to it, really faster, which is also claimed on the internet? I'm skeptical of that too, because again, the articles that I read and the head-to-head studies that were reviewed talked about Wellbutrin having to take 4 to 6 weeks to have full effect, and Auvelity not so, that they help within 1 or 2 weeks. Honestly, I don't know how much I trust that. And I know in my clinical practice that a lot of times I will see patients that will say, on starting on Wellbutrin just as a simple norepinephrine booster, nothing else added to it, that will say, yeah, it took me 2 or 3 weeks, but it really kicked in. I saw a guy yesterday. That's exactly what he said. Took 2 or 3 weeks to kick in, but now I feel better on simply 150 of Wellbutrin without the dextromethorphan. So I'm a little bit skeptical about the new medicines. And it's funny because I get accused by commenters sometimes of being a shill for big pharma and things like that. I've heard that comment. The truth is, I don't really think that the brand name medicines that are out there, that they're spending thousands of dollars on television advertisements because they have to get their name out, I don't think they're necessarily better. And if I have a choice in my work today, am I going to use a $10 generic or a $1,000 brand name medicine? I'm going to go with the $10 generic every day. That's what I'm going to do. Now, other doctors may disagree with me, but that's my practice. That's how I handle it. If I was feeling symptoms of depression and I felt that Wellbutrin was the medicine I needed, I would probably do the entire dosage range of Wellbutrin before I would add dextromethorphan to it. And honestly, I might even add dextromethorphan. I might only add that at the top dose if I was going to do that. I'm not a huge fan of dextromethorphan, nor am I a huge fan of ketamine. Obviously, these are medicines that are being explored, and a lot of people talk about it. I've even seen people on the internet say, "Hey, I'm fine with ketamine and LSD and things like that. I just don't take Cymbalta or Wellbutrin," something which I just consider to be irresponsible. I don't know why somebody would say that, to take a dissociative versus a medicine that is safe, easy to take once a day, and is not a dissociative. So when I hear those things, I just check the source is what I do. So in summary, do I think Auvelity is worth the extra cost? And is it likely to be significantly better than Wellbutrin itself? I'm skeptical of both. So for the person who's taking it, I would say if it's good for you, it's good for you. Hopefully it's not costing you a lot of money. A tricky thing that might happen, because you know that a lot of primary care people prescribe these medicines, and some people might not yet understand that Wellbutrin is in Auvelity. So if you're in a situation where you're already taking Wellbutrin, well, you wouldn't want to add on Auvelity on top of it. Now, we don't believe that there's a norepinephrine syndrome the way there's a serotonin syndrome, but from a common sense standpoint, you wouldn't want to take double the medicine, and it wouldn't be right to take too much of the norepinephrine booster. So you don't want to be on a combination of Auvelity with anything else that is a norepinephrine booster like Wellbutrin. So that's the video that I made today about a medicine that I don't use very much, but I still hope it's helpful. And if you're taking Auvelity or talking about that with your doctor, I hope that these comments can sort of guide your discussion. So I'm Dr. Dave Psychiatry. Thanks for coming to see me today.